the first class of Dr. Klein's Healthy Heart program. This is Dr. Klein. This program, which consists of 6 classes, is designed to guide you and help you restore your blood pressure, cholesterol, and blood sugar levels to normal naturally and improve your health all around. Before I start today's class, let me introduce myself, my credentials, and why I developed this Healthy Heart program for you. I am a naturopathic doctor with a clinical focus in the area of cardiovascular disease and diabetes, and the author of the book Read This If You Have a Heart. If you haven't dealt with a naturopathic doctor before, allow me to share with you some basic information about what a naturopathic doctor is. In Ontario, where I practice, and in several provinces in Canada, and many other states in America, naturopathic doctors are regulated as primary healthcare practitioners. This means that, like medical doctors, I'm trained to diagnose and treat disease, and that by law I'm permitted to do so. The big difference, of course, is that as a naturopathic doctor, I'm trained in and use natural methods to treat disease. While conventional medicine is great at treating acute and urgent care conditions, naturopathic doctors are well suited to successfully treat chronic conditions related to diet and lifestyle, such as different forms of cardiovascular disease, diabetes, osteoarthritis, digestive conditions, and so on. Next, I'd like to share with you why I developed Dr. Klein's Healthy Heart program. Why would it not be sufficient to follow the current model of medical care? Why is it so important for your health? My interest in the prevention and in the safe and effective treatment of cardiovascular disease began when I started my naturopathic practice about 10 years ago. I was getting a disproportionately high number of patients with risk factors for cardiovascular disease, including high blood pressure, high cholesterol, diabetes, and other related conditions. Many of them told me that they were doing the right thing, so to speak. They were limiting their fat intake, cholesterol, and salt. Many were choosing whole grain products, and most of them didn't smoke either. Yet despite these measures, they weren't healthy, and they ended up on multiple medications for blood pressure, cholesterol, and diabetes. To understand why following currently accepted dietary recommendations is not necessarily going to protect you from cardiovascular disease and diabetes, consider that there is a mountain of scientific evidence that shows that some of these recommendations are misleading. It turns out that many of the foods that we typically restrict in attempting to prevent heart disease and diabetes are actually healthy and important to our well-being. Meanwhile, there are other types of foods that we have been erroneously eating too much of, which do contribute to cardiovascular disease and diabetes. Moreover, there are specific foods and specific natural agents, including certain herbs, vitamins, and minerals, that can help improve your cholesterol levels, high blood pressure, and diabetes without causing the kinds of adverse effects that some pharmaceutical drugs cause. Published medical research reveals that in many cases, diet, supplements, and exercise are more effective than medications at preventing cardiovascular-related deaths. It is pretty simple to adopt the kind of diet and lifestyle habits required to improve and heal cardiovascular disease and diabetes. You just need to let go of some old ideas that haven't served you and be open to learn what steps you need to take to turn your health around. I'm here to teach you and guide you step by step so you can restore your health, stay healthy, and require fewer or no medications. Today's class constitutes the foundation for the course. I will cover many important concepts and you will learn a lot. I will discuss key concepts in the treatment of cholesterol, blood pressure, and diabetes, as well as potential adverse effects of commonly prescribed medications. I will reveal several misconceptions related to these conditions, as well as common mistaken beliefs about diet. I will teach you what causes diabetes and arterial plaque, and will provide an example of how natural agents can assist in recovery. Cardiovascular disease implies any condition or disease that affects the heart, that's what the word cardio stands for, or the blood vessels, that's what the word vascular stands for. However, 90% of cardiovascular disease is a function of narrowing and hardening of the arteries, primarily due to plaque buildup, which can lead to a heart attack or a stroke. The scientific name for this is atherosclerosis. Also, while there may be various causes for hypertension, the main reason for hypertension, especially as we get older, is narrowing and hardening of the arteries. So if you learned how to prevent or reverse arterial plaque, in all likelihood, you will be able to prevent a heart attack or a stroke. As well, some people suffer from various conditions of heart rate and rhythm abnormalities. While this represents a somewhat more complex type of heart disease, in Class 3, I will talk about nutrients that are important for regulating the heart rhythm and rate. Let's start the discussion about cholesterol. You have been likely told to limit your intake of dietary cholesterol in order to keep your cholesterol levels under control. This may give you the impression that cholesterol is some harmful poisonous substance that comes from food. In reality, most of the cholesterol in your body is made from within by almost every single cell, with your liver being the most significant contributor. In fact, 85% of the cholesterol in your body is made from within. And while you may have heard that cholesterol-rich foods are harmful, most studies show that the diet rich in cholesterol does not necessarily lead to high blood cholesterol levels. So you don't have to worry about eating eggs, for example. It is perfectly fine to have a couple eggs a day. The reason consuming dietary cholesterol may not necessarily increase your blood cholesterol levels is that your body has an internal feedback system that detects any increase in dietary cholesterol, and as a result of that, decreases its own internal production of cholesterol in order to maintain a balance. Your body makes cholesterol because you need it for many things. For example, 20% of the human cell membrane consists of cholesterol. A cell membrane is like a wall that functions to protect the content of your cells. It also functions as a selective barrier that allows the passage of important substances and nutrients into the cells, while working to keep harmful substances outside the cells. One of the important nutrients that need to enter your cells is glucose. Glucose is your most important source of fuel for metabolic energy, energy to sustain life. When the amount of cholesterol in your cell membrane decreases, its function is affected, a matter that prevents the optimal passage of glucose into the cell. The limited ability of glucose to enter your cells may result in increased blood levels of glucose and diabetes. The American Food and Drug Administration and Health Canada have recently recognized that commonly prescribed cholesterol-lowering statin drugs may cause diabetes. Diminished glucose in the cells may also contribute to poor energy levels and affect various life-sustaining functions within the cell. Cholesterol is also a molecule the body uses to construct a variety of important hormones known as steroid hormones. These include sex hormones that play various important roles in your health, such as estrogen, progesterone, and testosterone, as well as other hormones such as cortisol, which plays a role in inflammation, immunity, and stress management, aldosterone, which helps regulate blood pressure, and vitamin D, a hormone that has many functions including regulation of blood pressure and blood sugar regulation, absorption of calcium, ensuring strong immunity, and prevention of cancer. Because of the many roles of these hormones, lower cholesterol levels may have widespread implications for your health. 25% of the cholesterol in your body is in your brain and nervous system. It is an important part of the outer covering of the nerves, which is called myelin. Low cholesterol levels may affect your ability to think, to focus, to remember, and your mood. This list represents adverse effects associated with commonly prescribed cholesterol-lowering medications known as statin drugs, such as Lipitor, Crestor, and Zocor. I've already made the link between some of these adverse effects and the various functions of cholesterol. These medications may also cause liver and kidney damage. I see early signs of kidney damage in my patients all too often to my liking, even in people who have been on cholesterol-lowering medications only for a short period of time. The most commonly reported adverse effect is muscle and joint pain or weakness. This is likely because these medications interfere with the production of coenzyme Q10. Coenzyme Q10 plays a role in energy production. There's lots of CoQ10 in your muscles because they require lots of energy for movement. Inadequate levels of CoQ10 may cause feelings of weakness and fatigue. The heart, too, being your most important muscle, has lots of coenzyme Q10, and studies show that low coenzyme Q10 levels are associated with a greater chance for congestive heart failure. If cholesterol is so important, How can it possibly be dangerous? The fact of the matter is that there is plenty of research and many scientists and doctors that cast doubt about the relationship between cholesterol and cardiovascular disease. In order to save time, I will provide a couple of examples to support this idea, and you can find additional resources on my website at www.drkleinhealthyheart.com. One example is a study of over 100,000 heart attack patients who had their cholesterol levels tested upon admission to the hospital. 75% of them had normal or low cholesterol levels. In another study, people between the ages of 60 and 85 were followed for 12 years. In the group of people with the lowest cholesterol levels, mortality rate was increased by 60%, whereas in the group of people with normal or high levels, mortality was lower by 21%. The scientific literature shows that there are other substances in the blood that can better predict risk levels for cardiovascular disease. In Class 4, I will provide you with a list of these substances. In the meantime, I'd like to point out one of my favorite tools to predict any presence of plaque in the arteries, and that is the carotid artery ultrasound. It allows you to actually see any presence of plaque, which ultimately is perhaps the clearest way to determine your level of risk for having a cardiovascular event. While an angiogram is a procedure that provides that ability, it is an invasive procedure that is given only to acute care patients who may have just had a heart attack or who may experience angina chest pain. However, an ultrasound of the carotid arteries, which are the arteries that run along both sides of your neck, is a great way to safely visualize any measure of plaque. Research reveals that the extent of plaque present in the carotid arteries correlates to plaque presence in the coronary arteries, the arteries around your heart. Like anything, it is not always 100% accurate, but it is a valuable tool nevertheless. And like I said, later in the course, I will teach you what other ways you can use to assess your degree of risk. If after everything I shared with you so far, you still just want to get your cholesterol levels down and prefer doing it naturally, you'd be glad to know that there are many natural agents that can help you do just that. Only remember that simply lowering your cholesterol, even when it is done naturally, gives no guarantee for arterial plaque regression and prevention of a heart attack or stroke. So here are some of the examples of scientifically validated natural cholesterol-lowering agents. First one is beta-glucan, which is a substance you can get from oat bran, plant sterols, garlic, glucomannan, which is a type of fiber, niacin, red rice yeast extract, and there are many, many others. When it comes to lowering cholesterol levels, bear in mind that the amount of cholesterol in your body is a balance between the amount of cholesterol produced by your cells and the amount of cholesterol eliminated through the colon. There are various reasons for elevated cholesterol levels, including insulin resistance, low thyroid hormone levels, stress, constipation, deficiencies of certain nutrients, and more. One agent for lowering cholesterol may be right for one person, while another may be right for someone else. What determines what's best for you is the underlying cause of your elevated cholesterol levels. All throughout classes 2 to 4, I discussed dietary strategies and natural agents that can be used to balance cholesterol levels, and I will also teach you to identify the ones that are likely better suited for your needs based on your particular situation. Let me discuss important concepts about blood pressure next. Blood pressure is considered normal when the upper or systolic reading ranges from 120 to 140 and the bottom or diastolic reading ranges from 80 to 90. A diagnosis of high blood pressure is made when it is greater than 140/90 in 3 consecutive readings on 3 different days. There may be various causes for high blood pressure. It is associated with atherosclerosis or narrowing and hardening of the arteries, and with insulin resistance, a concept I will speak about shortly. Both these factors result from poor diet and lifestyle choices. High blood pressure is also associated with stress, low thyroid hormone levels, poor kidney function, and more rare factors such as tumors that secrete certain hormones that raise blood pressure. I will teach you how to identify and address whatever is causing your high blood pressure over the course of the program. Now, it is important that you are aware that just because blood pressure creeps above 140/90, there's no need to rush to medicate. In fact, in the US, treatment guidelines for high blood pressure in people over 60 have been changed recently, and the recommendation is that medicating is warranted only once blood pressure levels exceed 150/90. I'd also like to point out the findings of a scientific review that were published in a medical journal called the Cochrane Database of Scientific Reviews. Researchers found out that at levels of up to 160/100, people who were taking medications lived just as long as those who did not take medications. In other words, blood pressure medications did not prolong life at blood pressure levels of up to 160/100. While blood pressure is a risk factor for stroke and kidney disease, it seems that it is more likely to cause harm when it is consistently higher than 160/100. Some people experience high blood pressure at the doctor's office, but not at home. This is called white coat syndrome. This basically means that at the presence of a doctor, a person may get more nervous than usual, and this drives blood pressure up. 4 out of 10 people have white coat syndrome. In a statement published by an expert panel in the Journal of the American Society of Hypertension, they suggested that home blood pressure monitoring is more accurate. As well, if you and your doctor suspect you have white coat syndrome, your doctor could arrange for a 24-hour blood pressure monitor, which you would wear for 24 hours, and will measure your blood pressure readings as you go along with your daily routine. The next concept I'd like to bring up is the idea that blood pressure doesn't remain static throughout the day. It can temporarily fluctuate by up to 25 to 30% and be influenced by different activities, stress levels, hydration, and other factors. These temporary changes in blood pressure are directed by various regulatory mechanisms that the body uses to increase or decrease blood pressure. There are nervous system controls of blood pressure, hormones that influence blood pressure, changes in water levels, certain minerals such as calcium, magnesium, and potassium influence blood pressure, and a few other factors. Blood pressure medications work by acting or influencing these various modes of control. On the slide here you see a list of a number of modes of control and of different types of classes of blood pressure medications that act on these modes of control. A simple internet search of the name or brand name of your blood pressure medication will reveal which class it belongs to. Beta blockers work on the nervous system. Calcium channel blockers prevent excessive contraction of the arteries in the heart by blocking access to calcium. Diuretics increase the elimination of water. ACE, or angiotensin converting enzyme inhibitors, and ARBs, or angiotensin receptor blockers, modify hormonal influences that affect water balance. So all these medications act on and interact with these short-term controls. Well, the issue is that all these controls are meant to direct short-term changes to blood pressure. But when you take a blood pressure lowering pill indefinitely, you force what is meant to be a short-term control of blood pressure into permanence. The medication basically suppresses blood pressure, but does nothing to deal with the underlying cause of the elevated blood pressure. In turn, the suppressive nature of these medications is responsible, at least in part, for their potential adverse effects. Beta blockers may produce weight gain, impotence, reduced exercise capacity, poor sleep patterns, diabetes, and potentially congestive heart failure. Calcium channel blockers may produce constipation, tiredness, abdominal pain, palpitations, headaches, hot flushes, water retention, and again, potential for congestive heart failure. In fact, studies show that while beta blockers and calcium channel blockers are effective at lowering blood pressure, people who take them don't live as long as those who don't take them. Research shows that beta blockers may not save lives even at blood pressure levels of up to 200 over 120. Diuretics act to remove water from your blood vessels by increasing urination. There are two main types of diuretics: those that cause a loss of minerals such as potassium and magnesium, and those that keep potassium in the body. Diuretics that cause a loss of minerals are more commonly used. It so happens that both potassium and magnesium are important for regulating blood pressure and blood sugar, and magnesium specifically is involved in regulating cholesterol levels in the body. As a result of that, these medications may contribute to onset or progression of diabetes and elevated cholesterol levels. These last two classes of medications are considered the safest. Nevertheless, they may also produce a variety of adverse effects. ACE inhibitors may produce cough, skin rash, loss of taste, fatigue, headaches, high potassium levels, kidney impairment, angioedema, so swellings of the extremities, and increase in existing pain. ARBs may produce dizziness, headaches, high potassium, rash, diarrhea, indigestion, abnormal liver or kidney function, muscle cramps and pain, insomnia. As you can see, it is probably best to try to lower and manage your blood pressure naturally, and you will certainly get the know-how and the guidance in this program. Next, I will discuss key concepts in diabetes. There are two main types of diabetes: insulin-dependent and insulin non-dependent diabetes. Insulin is a hormone with various functions. One of its functions is to facilitate the entry of glucose into the cells. It attaches itself to a receptor on the cell's membrane, acting like a key to unlock a gate that allows glucose to enter the cell. Insulin-dependent diabetes is a condition in which the cells of the pancreas, where insulin is made, get damaged and insulin cannot be produced anymore. It usually starts in childhood and is treated by injecting insulin several times a day. Insulin non-dependent diabetes is more common and usually starts in adulthood, usually in mid-age. It results from a reduced ability of the cell to respond to insulin. The receptor on the cell's membrane loses its sensitivity to insulin and the cell becomes more resistant to it. Because of the diminished response to insulin, the cell isn't able to absorb sugar properly. Insulin resistance is closely related to high blood pressure, elevated cholesterol and lipid levels in the blood, to obesity, arthritis, Alzheimer's, and premature aging. I will teach you what causes insulin resistance and how to treat it in classes 2, 3, and 4. Here is a list of commonly prescribed medications for diabetes. I believe that by the time of this recording, the last medication listed at the bottom, Avendia, may have been discontinued because it was causing too many cardiovascular-related deaths. I want to make a couple of quick points about metformin, the most commonly prescribed anti-diabetic agent. Notice it causes a reduction in levels of vitamin B12. This is unfortunate for diabetics. B12 plays a role in ensuring the structural health of the nerves and may be important for preventing nerve damage. One of the complications of diabetes is neuropathy, a decrease in the sense of touch due to nerve damage. With depleted levels of B12, it may be even harder for diabetics to protect their nerves. As well, another potential issue is the fact that one of the complications of diabetes is kidney damage. A potential adverse effect of metformin is kidney damage. So while these medications help lower blood sugar levels, again, they are not curative, and I have yet to see a person with diabetes reverse diabetes by using these medications only. I certainly have helped many people reverse diabetes naturally. In most cases, type 2 or insulin non-dependent diabetes is reversible. As well, when blood sugar levels get stabilized, blood pressure and cholesterol tend to improve on their own. In diabetes and conditions related to insulin resistance, including high blood pressure and cardiovascular disease, sugar, specifically glucose, can be a double-edged sword. On one hand, it is your primary source of fuel, which enables the sustaining of life, and that happens only when it is able to get into your cells. However, when it is unable to enter the cells, it may become quite harmful. Sugar is sticky by nature. If you touch any sugary food like candy or ice cream, you notice that it sticks to your hands. This property of sugar is responsible for its sticking to blood vessels, to nerves, and to connective tissue in your joints and other structures it isn't supposed to come in touch with. The sticking of sugar to arteries makes the arteries sticky so that other materials can stick to them, and that is one way by which arterial plaque starts forming and developing. This process of sugar sticking to other structures in the body is called glycation, and it is implicated in cardiovascular disease. Now, what I'm going to share with you next is very important for treating diabetes and conditions of insulin resistance successfully. There is this idea that too much sugar causes diabetes, and this idea is inaccurate. In Class 2, I will explain to you the difference between healthy sugar and unhealthy sugar in a new way, a way you likely haven't heard of before. My goal is not to deprive you of sugar, but to help optimize your cell's ability to absorb it so it serves its function well and doesn't harm you. Now, sugar isn't the only problem. Other than sugar, there are other important factors which are usually ignored that are implicated in diabetes and conditions of insulin resistance. The first factor is the role hormones play in sugar metabolism. Let's take the hormone cortisol, for example. When you're stressed, the body produces lots of cortisol, which is responsible for helping you cope with stress. When you're stressed, you need more energy to deal with stress. To get more energy, you need more fuel in the form of glucose. Cortisol is responsible for increasing the amount of glucose circulating in your blood vessels. In addition to stress, unhealthy oils also play an important and often ignored role in the onset of diabetes. This brings me to an important example regarding common misconceptions that may make the difference between health and disease, and I will explain it in the context of oil in a moment. So while for the most part heart disease, stroke, high blood pressure, and diabetes are easily preventable and reversible, there are pervasive common misconceptions and misinformation about diet that cause all these conditions. The topic of healthy and unhealthy oil falls into this category of misinformation. While I address it in detail in Class 3, I will start the discussion on oil and fat today. You have been told for years to stay away from saturated fat, which comes primarily from animal fat, including dairy products. Indeed, as this graph reveals, the consumption of animal fat has dropped by about 2/3 over the past 100 years. You'd expect this to help prevent cardiovascular disease and diabetes. But over the same period of time, the incidence of coronary heart disease, stroke, and diabetes has gone up exponentially. In recent years, the media has reported on several studies that refuted the relationship between saturated fat and cardiovascular disease. In the same period of time, the last 100 years, the consumption of polyunsaturated fatty acids has tripled. Polyunsaturated fatty acid comes from supposedly healthy vegetable oil like corn, cottonseed, canola, and soy oil. Somehow, as the consumption of these oils has tripled, the incidence of coronary heart disease and diabetes has skyrocketed. Based on this information, I would easily choose butter over vegetable oil. I will clarify any confusion surrounding oil in Class 3 and will provide you with a detailed handout of different types of oil and fat in order of preference. By the way, the word PUFA on the top of the slide stands for polyunsaturated fatty acids. Another misconception is the notion that salt causes high blood pressure and cardiovascular disease. The fact of the matter is that the scientific literature on this topic is not unanimous. One recent review of 167 studies concluded that salt reduction may actually be a risk factor for cardiovascular disease. The fact of the matter is that both sodium and chloride, which make up salt, play various important roles in human biology. One of the roles of sodium is to facilitate the entry of various nutrients into the cell, including glucose and vitamin C and calcium. Increased sodium levels acts differently on different people, and it seems to drive blood pressure up more specifically when potassium levels are low. Keep in mind that 80% of the salt ingested in the Western world comes from processed foods, and processed food is generally devoid of potassium. One good source of potassium is fruit and vegetables. Limiting salt isn't necessarily going to help you get better. So many people limit their salt consumption, saturated fat intake, and eat whole grain, and still end up with high blood pressure, cholesterol, diabetes, and blocked arteries. Now I want to integrate some of the ideas I shared so far and explain what causes plaque buildup in the arteries, which can lead to a heart attack or stroke. There are three main processes that cause that. The first process is glycation, the sticking of sugar to the arteries. Once the arteries are sticky, other substances can stick to the arteries as well and contribute to plaque development. This doesn't affect only the arteries. It also affects your joints, your nervous system, your brain, and other structures in the body. How do you prevent and reverse this? You help your cells absorb sugar better, and I'm going to teach you all about this in the next couple of classes. For now, as I mentioned earlier, one important way to help your cells absorb sugar better and reduce glycation is to minimize the intake of vegetable oil. The next process that causes plaque is oxidation. It is closely associated with glycation, and it is caused by unhealthy oil, poor food choices, certain toxins, cigarette smoke, and other factors. Oxidation of the arteries resembles, in a way, the development of rust on metal. The whole process corrodes the metal and makes it stiffer at the same time. As a result of oxidation, arteries too become weaker and stiffer at the same time. As the arteries get damaged, the body tries to repair them. In fact, anytime there's damage to structures in the body tries to repair. This repair process is called inflammation. If the body is successful in repairing the arteries, then much like a way a scab on the skin sloughs off when the skin is healed, arterial plaque too will slough off when the arteries are healed. When repair occurs, elasticity is restored, and this facilitates improvement in blood pressure. In fact, both the skin and the arteries are similar in that they both consist primarily of the same substance. They both consist predominantly of collagen. So in repairing either the skin or the arteries, the body makes and lays down a new collagen to replace old damaged collagen. The skin usually heals well because a scrape or cut that injured it happens occasionally, and there are no recurring injuries that interfere or slow down repair. The arteries, however, are damaged constantly from glycation and oxidation due to poor diet and lifestyle choices. So it is important to learn and implement dietary measures and lifestyle choices that stop the recurrent damage to the artery. In my experience, in most cases, arterial plaque can be reversed or at least reduced in size. Certain vitamins, minerals, and amino acids can help with that. I will teach you what they are and how to use them in class number 3. To illustrate the importance of vitamins and other nutrients for your health, I will give you one example today. I will discuss the most important nutrient for your arteries, which is vitamin C. Most people don't know how important vitamin C is. Perhaps you heard that it may help with a cold, or that you can get it from citrus fruit, but there is much more to vitamin C. First, vitamin C is involved in artery repair. It is the most important nutrient that is required for the repair and the production of collagen. As I explained a few minutes ago, the arteries consist mostly of collagen, and when new artery tissue replaces old artery tissue, the plaque in the arteries starts sloughing off and recedes. With collagen or artery repair, elasticity is restored, and perhaps this is one reason for vitamin C's potential efficacy in lowering blood pressure, which was confirmed by a study listed on the slide. The study was published in The Lancet, a prestigious medical journal. Here, vitamin C taken at 500 milligrams per day helped lower blood pressure by an average of 9%. Also, perhaps because of its role in healing the arteries, it contributes to longevity. In one important study, people taking 300 milligrams vitamin C from diet and or supplements compared to those taking only 50 milligrams lived 6 years longer. Along the same line, 2 large studies established vitamin C as the single most important nutrient for preventing a stroke. Vitamin C is also involved in cholesterol regulation. It is required for converting cholesterol to bile acid, which is a prerequisite for eliminating cholesterol through the colon. It also acts on a key cholesterol-producing enzyme. It slows it down, which slows down cholesterol production. One study suggested that to use it for cholesterol reduction, you need to take no less than 1,000 milligrams. While I'm not treating you through this medium, I'm only providing information and guidance, I'd like to make the point that in my experience, it wouldn't be as helpful to take less than 500 milligrams of vitamin C per day. In fact, the worse your condition is, the more you need. When I work with patients on reversing plaque, I would sometimes recommend formulas containing anywhere from 2,000 to 6,000 milligrams of vitamin C. And I know of doctors who take as much as 10,000 milligrams of vitamin C per day. You will need to consult a doctor about the right dose for you if your iron levels are high or if you have kidney failure. So this brings me to the end of class number 1, which laid down the foundation for the rest of the program. Was this class interesting? Do you feel you learned a lot? Are you ready to learn more about what you need to do to take charge of your health so you'd require fewer medications and feel better? I discussed the importance of learning to identify and treat the underlying cause of your condition as opposed to suppressing the symptoms. I exposed a number of follies in the current treatment model which maintain the status quo, which has turned easily preventable conditions into a significant public health epidemic. Now it is time to get down to the meat and potatoes, so to speak. I will teach you what you need to do. Are you ready to take charge of your health? Over the remainder 5 classes of the program, I will guide you and support you. I will take you by the hand. You will receive lots of detailed handouts about diet, healthy brands, supplements, and information about different resources that are available to help you, as well as you receive assignments to help you apply the information you learn. If you live in the Greater Toronto Area, you could attend classes in one of several locations. Class locations, dates, and times are listed on www.drkleinhealthyheart.com. The program is also available for you online in 2 ways. First, the complete program, including all additional 5 videos, all class handouts, as well as assignments, and an electronic PDF copy of my book, Read This If You Have a Heart, will be emailed to you upon registration. Each class is approximately 45 to 60 minutes long and is available in both audio and video format. The recordings, the handouts, and the assignments constitute the entire curriculum that I put together for you. Dr. Klein's Healthy Heart Program curriculum is available to you at the tuition level listed on the slide. I hope you appreciate the program's great value considering its potential positive effect on your health, well-being, and longevity. You can also register for the complete interactive program option, which in addition to all class videos, the entire class material, and my book, will enable you to personally get your questions answered by me. You will need to gather all the questions that may come up for you after each class and email them to me, and I will answer your questions. Please be aware that I can't legally treat you through this medium, but I will do my best to answer any questions relevant to your situation. To do this, I will have to charge you for time spent to do the additional work, and so the total tuition for this option is listed on this slide. Although I already made several references today to the topics I discuss in each class, let me review it briefly in an orderly fashion. In class number 2, I give you detailed dietary recommendations related to intake of carbohydrates and dairy products. Carbohydrates turn into sugar, and the goal is to learn which carbs can help you improve insulin sensitivity so that sugar can enter the cell and give you energy and not stay in the blood vessels where it can lead to high blood pressure, cholesterol, and diabetes. With regard to dairy products, some types of dairy products can be potentially harmful and some can be extremely healthy, so you will learn how to make healthy choices. In class number 3, I will expand today's discussion on oil and fat. You will receive a detailed handout outlining the various sources of oil in order of worst to best. I will also speak about best sources of animal and plant protein, and which protein forms are best suited to improve the health of your arteries and your overall health. My dietary recommendations, as you will see, are simple to follow and don't deprive you of flavorful foods. In class number 4, I will teach you a lot more about the use of vitamins, minerals, and other natural substances to get your blood pressure, cholesterol, and diabetes under control. I will also complete the discussion I started today about which nutrients are needed for the reversal of plaque in the arteries. If simply having high cholesterol and high blood pressure does not necessarily mean you are a candidate for a heart attack, then how do you determine your level of risk? In class 5, I will teach you that. I will also teach you how to understand your blood test results and when and how wean off your medications. In class 6, you will learn how to limit the negative impact of stress on your health as to help improve your blood pressure, cholesterol, and blood sugar control. And I will teach you what types of physical activity are best suited to help you improve your condition. Like many of my students to date, as long as you follow my guidance, you will likely experience improvements in your blood pressure, cholesterol, and blood sugar levels so that you'd be in a position to reduce your need for medications. If you have arterial plaque, by implementing what I teach you, chances are your plaque will recede. In addition to these improvements, you can also expect to lose weight if you need to, and will enjoy improvements in other areas of your health, including your digestion, sleep, energy levels, reduction in joint pain, and so on. Under the right conditions, the human body starts healing very quickly. My students and patients often experience improvements within days of implementing what they learn, and so can you. I urge you to be proactive about your health and register now for this life-changing program. Before I finish this class, let me share with you summaries of 2 testimonials that you can view on Dr. Klein's Healthy Heart Program's website. First, Marianne, who took my class in Innisfil, Ontario, said, "I couldn't sleep, I was tired all the time. Now, cholesterol and blood pressure are down, thyroid improved, I'm not diabetic anymore, and I just feel happier." Jim, who took Dr. Klein's Healthy Heart Program in Whitby, Ontario, said, "I lost 20 pounds in 6 weeks, belly fat. My blood pressure is more consistent and lower. I hope to reduce my blood pressure medications. I reduced my cholesterol medications. Sleep is 100% improved. Glucose down. I was borderline diabetic." If you have any questions before you decide to register, feel free to email us at contact@drkleinhealthyheart.com. I look forward to helping you improve your health naturally.